In the world of germs, new viruses are always popping up. They remind us that keeping everyone healthy is a big job. One of these viruses is called human metapneumovirus, or HMPV for short. Scientists found it in the Netherlands in 2001. Even though we only discovered it recently, HMPV has probably been around for a long time, maybe even decades. People probably thought it was just a cold or the flu. Finding HMPV was a big deal. It helped doctors understand what makes people sick, especially kids. HMPV is like a cousin to other viruses that cause coughs and colds. It spreads through tiny drops in the air when someone coughs or sneezes. This makes it easy to catch, especially in places with lots of people. HMPV can make anyone sick, but it's most dangerous for little kids, older people, and anyone who gets sick easily. Finding HMPV showed us how important it is to keep studying viruses. When we understand how a virus works, we can find ways to stop it. Scientists are working on vaccines and medicines for HMPV, but we still have a lot to learn. HMPV is sneaky. It gets into your body through your nose and mouth. Then it goes into the cells that line your airways and makes more copies of itself. This causes your airways to get inflamed and swollen, which makes it hard to breathe. You might start coughing, wheezing, and feel short of breath as your body tries to fight off the virus. Sometimes HMPV can lead to something called bronchiolitis. This is when the small airways in the lungs get inflamed, making it especially hard for babies and young children to breathe because their airways are so tiny. HMPV can also travel down to the lungs and cause pneumonia. Pneumonia happens when the tiny air sacs in your lungs fill up with fluid, making it hard to breathe and get enough oxygen. Most healthy people get over HMPV without any problems, but it can be very serious for people who already have other health issues. HMPV spreads easily from person to person, especially when people are close to each other. When someone with HMPV coughs or sneezes, they spray tiny invisible droplets containing the virus into the air. These droplets can travel up to 6 feet. Anyone who breathes in these droplets can get infected. You can also get HMPV by touching something that has the virus on it, like a doorknob, and then touching your face. It usually takes 3 to 6 days after being exposed to HMPV to start feeling sick. Many people just have mild symptoms like a runny nose, sore throat, and cough. However, some people, especially young children, can get much sicker with fever, wheezing, and difficulty breathing. Older adults and people with weaker immune systems are at risk of developing pneumonia from HMPV, which can be very serious. What makes HMPV tricky is that people can spread the virus before they even know they're sick. This makes it hard to stop outbreaks. There's no specific treatment for HMPV, so doctors focus on treating the symptoms and making the patient comfortable. Section 4, HMPV versus COVID-19, a tale of two viruses. Remember when COVID-19 started spreading at the end of 2019? It showed everyone how dangerous viruses can be. HMPV and COVID-19 are different viruses, but they spread in similar ways. Both viruses like to hang out in tiny droplets that come out of your mouth and nose when you breathe, talk, cough, or sneeze. This means you're more likely to catch either virus in crowded places. Both viruses can also cause similar problems, from mild cold-like symptoms to serious lung infections like pneumonia. But there are some important differences between the two. COVID-19 is much better at spreading than HMPV. It also causes a wider range of problems like losing your sense of taste or smell, tummy troubles, and long-term health issues. COVID-19 is also more deadly than HMPV, especially for older people and those with other health problems. However, HMPV is still a common reason why young children end up in the hospital, reminding us that it's important to take this virus seriously. Section 5. Protecting the vulnerable, prevention and future outlook. We don't have a vaccine or a cure for HMPV yet, but there are things we can do to stop it from spreading. This is especially important for protecting those who are most vulnerable, like babies, young children, the elderly, and anyone with a weaker immune system. Washing our hands is one of the best ways to stop the spread of germs, including HMPV. Use soap and water and scrub for at least 20 seconds, especially after you cough or sneeze. If you don't have soap and water, use hand sanitizer with at least 60% alcohol. Wearing a mask, especially in crowded places or where there's not much fresh air, can also help. Masks act like a shield to protect you and others, and don't forget to cover your mouth and nose with your elbow when you cough or sneeze. Finding HMPV taught us that we always need to be on the lookout for new viruses and learn as much as we can about them. When we understand how a virus works, we can find ways to stop it. HMPV might not be as famous as some other viruses, but it reminds us that we need to protect ourselves and each other from the silent spread of germs.